Welcome to the Think Factory podcast. We got one question for you. What keeps you up at night?
Hello and welcome to the Women's Roundtable podcast, powered by the Think Factory, where we learn how women think big and grow their business. My name is Susan Kleiner. I'm a partner with Outside General Counsel Solutions, and I'm the host of today's episode. I'm happy to have with me here today Deena Cohen. Deena is the business development and subject matter expert for maternal child health and substance use disorders and has worked for GoMo Health since January of 2021. Deena's prior roles were in clinical treatment, education, and program development at Central Jersey Family Health Consortium, Preferred Behavioral Health of New Jersey, and RWJ Barnabas Institute for Prevention and Recovery. Deena earned a bachelor's degree in political science from Stockton University and a master's degree in public administration from Fairleigh Dickinson University. She's a certified alcohol and drug counselor, certified tobacco treatment specialist, women's treatment specialist, and fetal alcohol disorder educator. So welcome. Thanks for being here.
Thanks for having me, Susan. When I hear all that said, it sounds like I have a really long list of things that I spent a lot of time doing. It's impressive on paper. I'm really not that impressive in person.
I disagree. Having talked to you and gotten to know you, you're every bit the expert, and so happy to have you here today. So first off, I just wanted to ask, what is GoMo Health and what do they do?
GoMo Health is a fascinating company. Well, we're based in Asbury Park, New Jersey, and we are not an app. Everyone likes to refer to us as an app. And we are a web-based platform. And unlike an app, we send SMS messages directly to our clients. So we work in different disease states, whether that may be diabetes, cancer health, heart health, substance use disorders, maternal child health. When we're hired by a provider, a hospital system, a pharmaceutical company, so we're business to consumer. And then the messages go out. We're an adjunct to what the company is doing to help people in their process of diseases because we treat people as a whole person. When you get diagnosed with any sort of disease or pregnancy in itself is a different disease state, not a disease, but a different state that the person was in prior, you get that diagnosis and you're sent out with maybe some pamphlets, maybe a certain amount of information and sent on your way. You go home and then the reality sinks in. 70% of people are non-compliant with their medication adherence. So what GoMo does is they send out messages a certain time of day, certain day of the week to keep people in compliance with their medication adherence, with their appointment reminders, with their mental health, their behavioral health, with activities to do, with shopping lists, everything to keep people whole, healthy on their own. So when I say adjunctly, when I was working in treatment, I would say that people wanted all of me at all times. And this is what this does. It is available to people all the time. So some of the messages are bi-directional, so people can answer them. They have certain keywords, so they can type in a keyword 24/7, and they'll get a message directly sent back to them. So one message may be smile, and they get a stupid little dad joke sent back to them. A message could be peer, and a peer story. A peer will appear to them on their mobile device, telling them what their journey was in their own recovery for themselves. So it's uplifting messages to help people. We also have what's called a companion, which is like a digital library of resources that's available to people 24/7 to help people in their journey of their disease states and help them when they're not in front of a doctor, when they're not in front of a counselor, when people are most in need of help.
Wow, that sounds fabulous. So if I'm hearing you, it provides a real continuum of care, right? Where you meet people where they're at. And I think what's fascinating about this is that it's highly personalized, not just from the business perspective, but also to the individual patient. Isn't that right?
Highly personalized, because most of our programs have about a 97% retention rate. And the reason our retention rates are the highest in the industry is because they are so personalized. So when somebody fills out the enrollment form, me, myself, would be a mom. I have children under the age of 18. Let's say I'm a smoker. Let's say my drug of choice may be heroin. Those messages I'm getting are to me. If you do not have children under the age of 18, you're not getting parenting messages. Maybe you're not getting smoking cessation messages. So you're not going to opt out because you're not getting messages that aren't related to you. So that's why our opt-out rates are so low.
And can't the people that get these messages, it sounds like it's a two-way street, or at least some of the time, where, a person can write in and they say, look, I need help now. And does GoMo Health forward it on to their provider? I mean, isn't that an element of this as well?
So there are certain business rules that we work with all of our clients. None of our programs are cookie cutter. We work with all of our clients, and we work with them to develop which of their messages have escalations attached to them. So we ask periodically, how are you doing messages on a scale of, let's say, 1 to 5, 1 being low, 5 being doing really well. So we'll trigger on a 1 or 2. The escalation will get emailed directly to the provider that someone needs to reach out to them. And different providers will have different business rules. So maybe in 30 minutes, somebody in 2 days, depending on what their business rules on, someone will reach out to them directly.
Wow, that sounds really great. What a way to, provide better care to patients, and also, the ability for the business to, really follow along, which they otherwise couldn't do. I know that I looked online and I saw that one thing that GoMo Health is involved in right now is the LED program by Tigger, which I thought was really interesting. I think it has to do with youth. And I thought that was an interesting example. Can you talk about that for a moment?
I'm very excited about the program, so I'm really glad that you asked me about that. That is the Tigger Stavola Foundation, based in Monmouth County, New Jersey. And unfortunately, the Stavola family lost their son about 10 years ago to an opioid overdose. So from that, Lisa Stavola and Rick Stavola launched a foundation called, their son's nickname was Tigger. They launched a foundation called the Tigger Stavola Foundation, and they work with prevention and education within the schools in Monmouth and Ocean County. So we got connected with them. I had a great conversation, and we talked about how, assemblies in the schools aren't enough, especially with adolescents. One and done doesn't work. And different federal agencies have talked about this over and over, that one and done. You can't say something especially to an adolescent, and expect them to walk out the door and carry that information and use it in their day-to-day living. So what we developed was, in adjunct with what they're doing in the schools, which is bringing in assemblies, bringing in education, was we were going to build this program, because what do kids have on them all the time? Their cell phones. What are they attached to? Their cell phones. So working with their cell phones and their devices, it's a gamification program. So it's providing them with harm reduction education. So this is not a Nancy Reagan just say no program. It's harm reduction. We know that potentially kids are going to use substances. We don't want them to use them problematically. We hope they don't use underage. But if they do, we want them to know the risks associated with it and how to get help around it and how to not use harmfully. So in the first month of the program, when they sign up, it's a gaming. So twice a week after school hours, they get information, and then we ask them yes, no questions. And if they answer wrongly, we don't say, no, you got that wrong. We say, well, that's actually not the answer. So it may be, is driving under the influence of marijuana safer than driving under the influence of alcohol? Yes or no? They answer back. And after they answer the questions, they get a $5 incentive. and they were to Jersey Mike's, Chipotle, and Starbucks. So that keeps kids, incentives are what keeps kids connected. And with this program, we have a 94% retention rate. And I can really proudly say that as of today, we crossed the 1,000 mark in kids. And that is in 2 counties. 35 schools are enrolled, and we just launched that as of this upcoming year. We're offering it to the entire state of New Jersey.
Oh, wow. That's amazing. I have chills thinking about that, right?
No, it's really exciting.
And it's also amazing, that these parents, the Stavolas, faced with such devastation, have been able to make such an impact and such a difference. I think that's also really important in terms of stigma, right? Like we often think that it can't happen to us, or, it's only this type of family or this type of person. And that's absolutely not the case.
Of course. And I think that's one of the things they wanted to get out there, was lowering and reducing stigma in the communities. Like, look at us. We're this very, wealthy, well-off family. And if it can happen to us, it can happen to anybody. And if we can save, and that's part of the program's success, if we can save one kid, one family from this happening to, then we're successful. And after the first month of the gaming program, every Friday for the rest of the school year, they get another message continuing Friday afternoon before they go out for the weekend, just reminding them, little guy on their shoulder, just reminding them about the Good Samaritan law, which is to call 911 no matter what. They can't be arrested. They can't get in trouble. And the feedback from the kids is, about 91% of the kids did not know about the Good Samaritan law prior to this program. So think how important that is, that these kids are going to call 911 now, stay with their friend, and wait for help to arrive, which would not have occurred before this program.
Wow, that's fantastic. And you said you're going to roll it out? It's getting rolled out to the entire state of New Jersey?
The entire state, yes.
Wow, that's some great news. You must be very proud of GoMo Health and to be a part of that. So in talking to you, and certainly, in looking at your bio, you've had a pretty interesting career where you've gone from being a provider and now you're involved in technology. I'd just love to hear some more about that. I know that making changes in your career is really difficult for a lot of people. And if you could tell us some more about how that came about, I think it could be instructive to our listeners.
Sure, I'm happy to. So when I first started out in my career, it was in women's treatment, running a women's treatment program in Ocean County. And that was for about 7 years. And, needless to say, that was very difficult, watching women struggling, very difficult with children. And it was a revolving door, to say the least. And after a long time doing that, I got an offer. Somebody I knew was moving out of the position at Central Jersey Family Health Consortium, and that was moving into the prevention world. So that was going out into the hospitals, doing education, going into the clinics, going out into the schools, which I loved working with the kids, and getting the word out. Going into the Intoxicated Driver Resource Center, working with people that had a DUI, and they were mandated to go to classes, and giving them education about alcohol and the effects of alcohol, the effects of pregnancy with alcohol. So did that for quite a long time, and I was a client of GoMo's. Yeah, the Governor Christie, on his way out the door, his administration dumped a lot of opioid money on the state. And the 3 consortiums were charged with different things. And the Central Jersey Consortium was charged with educating providers and consumers with education on the opioid crisis, with maternal child health, perinatal, which is before, during, and after pregnancy. And we hired GoMo Health to help us work with women that were pregnant, that were on their journey on medication for opioid use disorder. So that would be methadone or buprenorphine, to keep them compliant with their medication during their pregnancy. So we hired GoMo, and I got to know the players with GoMo, loved everyone that worked here, and it was an amazing journey. We educated the providers, we educated the people in the community, and worked very closely with everybody here at GoMo. And then, as we all know, the pandemic hit, and I couldn't do what I was, typically doing, which was going out into the hospitals, going into the methadone clinics, doing everything that I loved, but it was going into facilities, which we all know we couldn't do anymore. So my joke is, Bob Gold is our CEO and founder, and we both live in Asbury Park, New Jersey, and GoMo Health is located in Asbury Park, New Jersey. So the joke is that Bob found me walking the streets of Asbury Park, which he literally did. I was walking my dogs.
Okay.
I was walking my dogs during the pandemic, and he was having dinner with his wife outside of a restaurant. And his wife commented on my dogs, and I looked up, masks and hats and all, and I was like, Bob, you have to save me. I'm staying home. I'm doing nothing. I can't do what I love to do. And he said, you know what? This is perfect timing because we're looking to expand our substance use disorders and maternal child health departments. Let's have dinner on Tuesday night. This was a Thursday. He emailed me on a Sunday night and said, I worked it all out. As anyone who knows Bob knows, his mind is working a million miles a minute. We met on Tuesday and he had everything written out, and he called my CEO over at Central Jersey Family Health Consortium because they're friendly. And she said, I just want Deena to grow and I love it and anything that will expand her career. And so it was just a progression. And Susan, if you're going to ask me, was I scared? I'm not young. So technology is not like my kids where they grew up with touching technology and living technology. And so it was scary. It was definitely quite scary moving into the technology world and all that it was, it encompassed. But I'm a risk taker by my personality. And I just jumped ship from where I was and presenting and going out. That was my comfort zone. I know it's not for most people standing in front of an audience of 400 people, but that was my safety zone, believe it or not sitting behind a computer. But I did it. And it took some time, but the fabulous, and I'm not saying this because I work here, I really mean it. When I was teamsing people on a Sunday night at 10 p.m. and saying, I need help. Can someone reach out to me? People couldn't do enough to help me and show me and share my screen and do whatever they could to help me grow and just support me. And it was still the pandemic, so I couldn't meet anyone face to face, so it wasn't a typical onboarding either. I was still sitting in my apartment with the doors locked with all my kids home from school, as everyone else was. And I've just grown as a human being. And I'm proud of the company I work for. I'm proud of the work that we do. It's an amazing group of people that support each other. And I've, grown as a person from taking risks. Sometimes being risky is good. And this is one of those times.
For sure. And it sounds to me like, what serendipity, right? To run into them. Good thing with the outdoor dining, right? Something that we all liked during the pandemic.
Yeah.
And for you to put all of your skills into use, right? In terms of treatments and prevention and, turn it all and get to work with a fabulous platform like GoMo Health. Good for you and good for you for taking that risk. So I'm curious, in talking to you, and maybe this goes into what you were just talking about, what advice would you give to your younger self, right? You said yourself, you're not young, but you've been around for a while. Like, if you could go back and talk to your younger self, what advice would you give yourself?
Definitely, because I'm giving this advice to my kids, significant others, and wives and everything else, because my kids are not young and they're getting into the workforce. So it's a good question that you're asking me. That don't get comfortable in the place that you're in, workplace. Because you always think, well, they give me flexibility. I feel safe. I feel comfortable. And then you move on to the next place and you're like, shucks. This is just as comfortable. I have just as much flexibility. They're just as kind to me here. I wish I had made this jump earlier. So maybe staying with places too long and not moving, not that you should change jobs every year, but looking, getting too comfortable. I like my coworkers. I'm comfortable, but I've kept wonderful friendships. The people that are meant to be in your life, and you can keep them. but expanding yourself professionally is so important, and not being scared, because this was definitely a scary jump.
Yeah. I mean, and it also sounds like you really talk about, you have to keep yourself open for opportunities to grow. I've heard you talk about that, just here today. Going to GoMo Health for you was, such a change and departure, and you've learned so much. And boy, like, I'm sure you feel very grateful for that. So what do you have coming up? What's GoMo up to? What are you excited about?
So we've hired a chief growth officer recently who has, you want to talk about, he has taken a 12-horse, wagon, and it's off to the races. He is just pushing us fast and furious. We are moving and shaking like we literally never have before. Tigger, we're taking nationally, because I don't think anyone that I know of that I've seen is meeting kids where they are, which is their phones. People talk at kids, not with them. And just one trusted adult, we know this, I'm not making this up, this is by data and statistics, one trusted adult is all that a kid needs in their life for them to be successful moving forward. And so this program doesn't talk at kids, it talks with kids. So when they get the questions wrong, going back to the Tigger program, it just says, okay, well, actually, driving under the influence of marijuana is just as dangerous as driving under the influence of alcohol. So they learn something. I want to get this national because we want to keep kids from dying. The adolescents have lived through the pandemic. Mental health is at a huge, epidemic now. So I want to put more mental health into the Tigger program for sure. Gambling also in 18 to 30-year-old males is also at a huge epidemic that people are not talking about.
Yeah, for sure. I really haven't talked to anybody about that there's an epidemic there. Is that in part because of COVID? I mean,
they're doing it right on their mobile devices.
Yeah.
Right on their mobile devices. And I mean, on social media, the ads just keep coming through. You on TV, you may not be tuned into it because your brain is not wired that way. The ads are nonstop for these online betting. So it's so easy. So, to go to Atlantic City, you have to be 21. But if a kid gets hold of their parent's ID, plugs the information in, they're gambling all night long on their phones, during the school day on their phones.
Wow, that's really something. What an amazing program. You really have a lot to be proud of, and I'll certainly be interested in hearing more about GoMo Health's success in New Jersey and nationally in this incredibly important area. So if people want to get in touch with you, what's the best way for them to reach you?
They could text in, believe it or not, this is how fantastic GoMo is. I don't even have to give you my contact information. You could text in Deena, Deena, to the number 43386, and you'll get all my contact information.
Oh, very
It'll
cool.
come right back to you. Yeah.
Wow, that's awesome. Well, I'll try that out, Deena. And so we ask everyone that comes on to the Think Factory podcast what keeps them up at night. So yeah, where are you at with that? What keeps you up at night?
I would say, had to think for a second, I would say adolescent mental health. Adolescent mental health, where, the division in the country, the pandemic, there's a lot going on, and how do we bring kids back from they were isolated, kids missed out on proms, kids missed out on sports, being face to face. So how do we refocus them, recenter them, and bring them back to center? And it's going to take a lot of hard work on us, and it's our job as the adults in this country to lead by example on one part, and to build programs around what these adolescents need to help them, because it's not a made up thing. I mean, they lived through a lot, these kids, and we can't take that away from them. I mean, for us to imagine what they've gone through, missing out on these pivotal things in their lives, graduations, proms, so to bring them back to center.
Wow, for sure. So thank you. I want to thank you for your dedication and your hard work. And, with GoMo Health and even before that, it sounds like you're a tremendous advocate, for youth and, for people struggling with substance abuse and mental health. So, thank you. And I really look forward to hearing more about the good work of GoMo Health. So thank you so much for coming on to today's podcast. And be sure to check out the other Women's Roundtable podcasts so you can learn how women think big and grow their business. Thanks, Deena.
Thanks, Susan. Have a great day.